pleasure in getting a chance to talk today with Dr. Robert Shira. I guess if one was to talk about the triathlon athlete in dentistry, one would have to talk about Dr. Shira, Major General in the Army, Dean of a dental school, and President of the American Dental Association. So it's good to have you with us today, Dr. Shira.
Thank you. I'm happy to be here and honored to be included in this series that the International College is producing.
Thank you. When I take a look through all of those accomplishments, Dr. Shira, I start to wonder where that begins to come from and how it all got started. And I wonder if you might be able to kind of take us back to what you see as the beginning of some of these things.
Well, that's a hard question to answer because I suppose a lot of it is built into you and it just comes out as you get older. I was raised in Oklahoma, as you probably know, and I had a brother that was 10 years older than I that I thought a great deal of, and he went into dentistry. And so when I got through high school, that seemed to be the thing for me to do. And I went into private practice in Oklahoma. I practiced there for 6 years in a small town in northeastern Oklahoma, and I was very happy doing what I was doing, but I didn't feel I was progressing like I should.
Well, before you get off that, I want to hear a little bit more about Oklahoma. Now, I read that you were born in Pennsylvania, though.
That's right. I was born in Pennsylvania, but when I was 2 years old, my father moved to Oklahoma. He had been working in the steel mills in Pennsylvania, and he didn't feel that he was getting ahead very much, so he had read in a journal about the oil business in Oklahoma. So he went to Oklahoma to go in the oil business, and he didn't know a thing in the world about it, but he went out there and got established and became an oil well driller and finally owned his own tools and made a living drilling oil wells. And so that's how we got to Oklahoma.
Oh, now where in Oklahoma was that?
This was in northeastern Oklahoma. Bartlesville is the largest town, but I was raised in the little town of Dewey, 2,000 people in northeastern Oklahoma. And from there I went to school there. My prenatal work was in a junior college in Bartlesville, Oklahoma, which is 4 miles from Dewey. And from there I went to the dental school in Kansas City.
Now, at that point, you didn't go to college in between?
No. No, at that time there was only 1 year of predental required, and I had that in the junior college in Bartlesville, and from there I went directly into dental school. Later it became 2 years predental, and now most of the students going into dentistry have a baccalaureate degree, but that was a good long time ago, and so the requirements have changed.
Let me just make sure we get the years straight. You were born in
1910.
1910, and started dental school in
1928.
Okay.
Yes. And I graduated in 1932. Right.
And now tell me a little bit about dental school. You went to UMKC.
University of Missouri, Kansas City, then known as Kansas City Western Dental College. It was a proprietary school, a private school, and it wasn't until a good many years later that it became part of the University of Missouri educational system. That's right. And but it was a well-established school. It had been there for a long time, and it had a very good reputation, and it turned out good dentists.
And what was dental school like for you? Were you disappointed at all in the decision?
No, I know pretty much what to expect because of my brother being the dentist, and I was in his office some. It was difficult for me to start with because I didn't have the manual dexterity that I would like to have had, but that came with time, and so, no, it wasn't difficult, except it were difficult times. This was right in the height of the Depression, and you had to work. I know that I worked for a place to stay, and I worked for my meals, and went to school in the meantime, and so it was a struggle, but it was worth it.
Yeah. What kind of work did you do?
I worked in a restaurant for my meals, and the highest priced meal in that restaurant was 35 cents. And I worked in a hotel as the night janitor primarily, and all I got out of that was my room. Yes. Yeah.
So you got your meals and you got your room.
That's right, yeah.
All the rest was on your own.
That's right.
Now, we're almost up now to, you've completed dental school, and now you decided to open up a private practice back in Northeast Oklahoma.
That's right. I opened an office in Dewey, Oklahoma, my hometown, and during my first year of practice there, my brother, who practiced in Pawhuska, which was about 30 miles away, died suddenly at the age of 33.
Oh,
and so he had a 10-year practice going, and I moved into Pawhuska and took over his practice and maintained my practice in Dewey. So I had 2 offices for about 5 years. While in Dewey, I became acquainted with some people that were in the Army Reserve, and they talked to me about joining the Army Dental Corps Reserve, and I did. In 1936, I went on a tour of active duty down at Fort Sill, Oklahoma, and I liked what I saw. I guess one of the things that impressed me as much as anything else was that the football coach from West Point was there for summer duty, and it was Biff Jones, and nobody will remember that name but me. But anyway, I was an avid football fan, and I got to work on him, and I liked it. I couldn't see a great deal of future in Oklahoma, so in that small town, I could have gone to a larger town, but I thought I'd give the regular Army Dental Corps some thought. And I looked into it and found that 2 years later they were going to take in 12 or 13 dentists in the Army. And so I applied and took a competitive examination and was successful. I'm not real sure my wife has really ever forgiven me for doing it, because we had a successful practice, having taken over one that was in operation for 10 years. But I gave this up and went in for a salary of $167 a month. But we had lots of advantages. We had a lovely big home with a servant's quarter and a maid that we got for $1 a day, and they delivered bread to our quarters for 3 cents a loaf, and so we never lived any better than we did then at that amount of money. And when I tell the young people now going into the military what I got when I went in, they can hardly believe it. Yeah.
Now, when you came into the military, you were stationed where?
Barksdale Field, Louisiana. That was an Air Force, the Air Force, but there wasn't an Air Force when I went in. It was the Army Air Force. And so there was only one dental corps. It wasn't until after World War II that the Air Corps separated and became a separate corps. And those of us in the regular service at that time had to make a choice. Were we going to go with the Army or were we going to go with the Air Force? Yeah.
So when you were down in Louisiana, that was right probably before things were starting to heat up as far as the Second World War.
Absolutely. I went there in June of 1938, and I was there for a little less than 3 years. I was there until February of 1941, at which time I was transferred to Gorgas Hospital in the Canal Zone. The Gorgas Hospital was a large 1,000-bed hospital run by the Canal Zone government. It was the only United States hospital on the Canal Zone. It was a large hospital. It was really a civilian hospital, but all the physicians, most of the physicians were Army physicians. There was only one dentist there, and he was an oral surgeon. But there were a lot of people there that needed restorative dentistry, routine dentistry, and I was sent there ostensibly to do that. And so from February 1941 until war was declared in December 7th, 1941, I was there really doing general dentistry. Then the oral surgeon was ordered out immediately after war was declared. He came back to the United States and joined a hospital that was going with Patton's Third Army. And I was left alone at that hospital in the Canal Zone. And so that's really how I got into oral surgery.
So all of a sudden, you were the oral surgeon at that hospital?
All of a sudden, I was the oral surgeon at that hospital. That's right. And it was a big hospital. There were lots of oral surgery cases coming in. And the federal government at that time felt that the next target of the Japanese would be the Canal Zone. And so they started an awful lot of construction in and around the canal to build up bases there. So we got a lot of construction casualties, industrial casualties. And then the Germans were having a heyday. sinking the ships coming out of the ports on the East Coast and out of New Orleans, and they were sinking them one right after the other in the Caribbean. And these casualties, those that survived, came into our hospital. So we were busy as could be, and it was just me and a dental hygienist doing the oral surgery.
Oh my!
Yeah.
How did you manage with that kind of caseload?
Well, we worked hard. That's how we did it, and we worked 7 days a week. And I had done surgery in my private practice, and when I was at Barksdale Field, I did what surgery was to be done there. It wasn't a great deal. And then, of course, I had that 8 or 9 months with that oral surgeon in the canal zone, and while he was doing the surgery, I was in the next room, and I got to look over his shoulder quite a bit. But one of the greatest things that happened to me was that dental hygienist. She had worked with some fine oral surgeons. She'd been at Gorgas about 20 years, and she knew the techniques. And I would be working on a problem of getting maybe a deep impaction out, and she would finally become exasperated, and she'd put an instrument in my hands and say, if you'll use this, and this way we'll get that tooth out. And so with her and the experience I had and the books and lots of guts, we got it done. And one of the most prized possessions I have is a certificate from the Alnett School of Applied Dentistry. When I left, this hygienist had a diploma made, and she had it signed by the big shots in the canal zone of the governor, and she presented it to me when I left. And so that's how I became an oral surgeon. Right.
You went to school with this hygienist.
Yeah, right, yes.
And you left the canal zone, when was that?
1947.
Okay, so you were there all through the whole war.
I was there during the entire war, yeah. And because of the rapid escalation of the size of the military and the, I guess, responsibility of the job that I was doing, I went there in February of 1941 as a captain, and I became a full colonel in 1945. So my promotions were very, very rapid there.
Right.
Then after the war, there was a cutback, and I was reduced one rank to lieutenant colonel. But that only lasted a couple of years. I was then promoted again to colonel in '49, and I was a colonel for almost 20 years.
Now, when you came in '47, when you left the canal zone, you went where?
I went to Letterman General Hospital in San Francisco, which was one of the large Army General Hospitals, and I went there as chief of the oral surgery department, just with the background that I had at Gorgas, yeah.
Now, since that time, you've become a diplomate. You've got your boards in oral surgery.
Yes. The boards of oral surgery were established in 1947, and they conducted their first examination in 1948. There were quite a few people that were doing oral surgery that they grandfathered a few people, not over 10 people to form the board. Then they allowed those people who had been limited in their practice to oral surgery to take the board examinations without any further educational requirements. And so I fell into that category, and I realized that I was going to maybe be in oral surgery. I liked it, and so I decided to take that examination. And so I worked diligently. It was a hard examination. I spent about 2 years with all my free time going into that study, every free minute I had. And so in 1949, the second year that they were given the examinations, I took it and I was successful and became a diplomate to the board, yeah. And I must have done all right because the following year they made me a member of the examining committee that would examine other people that were taking the boards, yes. So I did become a diplomate, but I did it. They couldn't do it that way now because now they have to have formal training to be eligible to take it. But in those days, the early days of the board, I was able to get in. It wasn't a grandfather, and just those that were doing oral surgery, if they passed the exam, they become a diplomate. And the casualty rate was pretty high, but I was lucky and got by.
Now, you were at Letterman for how long?
I was there 7 years. 7 years, 1954.
Now, one of the things that I'm sure lots of people know you for is all of the continuing education courses you've given around the country. When did that get started?
That's another thing that happened by fiat, by being at the right place at the right time. In 1950, a directive came down from the Surgeon General's office that the chief of oral surgery at Letterman would conduct 2 5-day courses in oral surgery each year. And so, by direction, I was told to put on these 5-day courses.
And you would give these courses to whom?
Well, they were primarily for Army officers in the continuing education program. Those that were on active duty, for reserve officers, and also for officers of other services, the Navy and the Air Force, Veterans Administration, and as it progressed, it opened it up to civilians. And so for 4 years at Letterman, I put on 2 of these a year. And lots of people came to them from all parts of the country because of their assignments to the military. Then I got to Walter Reed, it dropped back to 1 a year, but we kept that up all the time I was in the service. And so that's what got me started. And I developed the teaching material, and I guess I gave my first major presentation at a state dental association at the state of Washington in 1955. And since then, I've been doing it ever since. Yeah, right.
And you hadn't done any real teaching before then?
None whatsoever. No, I became an oral surgeon by accident. I guess I became a teacher by accident, but I guess it's a God-given ability to communicate, because I love oral surgery, and I love to tell people how I do it, and hopefully that they would have the same success in it that I had, yeah. And I guess early on, I realized the importance of dealing with the people who were doing it. And while I lectured a lot to oral surgeons, I lectured an awful lot to people in general practice, because surgery is part of general practice of dentistry. We do need specialists, of course, but I'm sure an awful lot of surgery is done by general practitioners. And if they do it right, it's a good, productive part of their practice. And that's where I've done most of my lecturing.
And you have a really good perspective on general practice, because that's where you came from.
Yes, right. I know what it is. I certainly do.
Let's follow it along. So you were at Letterman then from 47 till
54,
and then you came to Walter Reed.
And then I went to Walter Reed. I just went from chief of oral surgery at Letterman to chief of oral surgery at Walter Reed, and we were busy in those days. You know, 1950, the Korean conflict started, and we were getting lots of casualties there, and we didn't get them cleaned up until we started getting into the Vietnam thing. And so, whether we like it or not, I've been through 3 shooting wars, you know, World War II, Korea, and Vietnam, and lots of maxillofacial casualties. And, you know, when you do it, you learn how to do it. And when you're the only one to do it, it's got to be done. And so you find out everything you can about something, you learn everything you can. If you don't know, you ask somebody, and then you go ahead and do it to the best of your ability. And so that's how we got through that. You know, it's unusual that I am an Army officer who spent 33 years in the military, and I never marched a step or made a formation. I was always doing dentistry. And it was embarrassing. When I became chief of the Army Dental Corps, I was on an inspection trip in the Far East. And I went into Korea, and the commanding general of one of the divisions there was a man that had been quite severely injured in World War II. And he had a gross defect in his face, and I built it back. And when I got to this division in Korea, he had the whole damn division out on the field, and I had to troop the line. And hell, I didn't know how to do it. It was embarrassing as could be. But anyway, it's been an unusual experience in the military as far as I'm concerned. But as I tell my officers, you're there for one purpose, and that's to do dentistry. Yeah, you got to be a soldier too, but if it weren't for dentistry, you wouldn't be here, so do dentistry and do it well. right.
And did you get to Vietnam at all?
Yes. Yes, I didn't get there as a permanent assignment, but as chief of the Army Dental Corps, we had an awful lot of dentists over there, and I went over there 2 different times and spent about 3 weeks each time I was there, and I went every place. I went where these dentists were working, up on the fire bases in their general hospitals, and it was a very, very revealing and profitable visit.
In what way?
To find the motivation of these young dental officers. I had to assign them to go over there, and not very many of them wanted to go. But when I got over there and saw what they were doing, and they saw what they were doing, and they saw the need for what they were doing, after it was over, there were very few of them that weren't very happy with the experiences that they had. The oral surgeons had a field day over there because of the type of war that it was. You know, it was a seek and destroy. There were no front lines. They were going out in the boonies looking for the enemies, and they were upright. And 20% of the injuries were maxillofacial injuries. And we had a situation there that was really, really fantastic. We had wonderful communications because of radio and because of electronics. We had helicopters that were assigned to the medical department. They were piloted by warrant officers of the medical department, and they were called dust-off pilots. And so when there was a firefight and there were casualties, the people at the point of conflict would radio in. The dust-off pilot would get his chopper up in the air. He would go up there. He would pick up the casualties, look them over, and they became quite astute. And if it was a maxillofacial injury, they would fly him to a well-equipped, well-staffed hospital where he would be on an operating table within 1 or 2 hours, where he was getting definitive care by well-trained oral surgeons in well-equipped hospitals, well-staffed with nurses. And so our results were really fantastic because of the tremendous, wonderful communications and evacuation system we had. We never had that in any other war. And so it was a learning experience for all of us, yes.
Tell me how you got to be chief dental officer.
Well, I often say it's because I lived longer than anybody else. Well, I guess, again, it's from being in the right place at the right time. As I said, I was there in the military the same as I was in private practice to do dentistry, and I did dentistry all the time. But I was in the general hospitals, and the surgeon generals usually were taken from the hospitals. And one of the people I worked with was the commanding general at Letterman Hospital. His name was Leonard D. Heaton. He was a colonel at the time, and then became a brigadier and then a major general. And I worked with him because I was an oral surgeon, he was a general surgeon, and he knew what I could do, and I knew what he could do. When he left Letterman, he went as commanding general at Walter Reed. And he hadn't been there a year until I got orders to go Walter Reed, because he knew me and got me there. And so I was there for 10 years. And then later he was the first military physician to become a 3-star general. He became a lieutenant general and became surgeon general. At this time I was in Europe, and he knew what was going on. I was put in that administrative position over there, but it wasn't long till he came over to Europe and saw what I was doing. And then, next thing I knew, I was a brigadier general. And I was a brigadier for about 7, 8 months, and then I was selected to be chief of the Army Dental Corps, and he was the Surgeon General. And again, I think it was being at the right place at the right time, and people knowing me, and my record showed that I did work, and so that's how I got it, I guess. I don't know. I often wonder myself how I ever got there, yeah. But it was wonderful, yeah.
Now, before becoming chief, you were over in Europe. This was that was a big administrative position.
I left Walter Reed in November of 1964 as the dental surgeon for U.S. Army Europe, which is a purely administrative position. You handle the administration of all the dental activity, Army activities in Europe, personnel, and supplies, laboratories, everything.
You went there from Walter Reed?
Went there directly from Walter Reed.
Yeah, okay.
I went over there and they started talking about the sink. Well, the sink is a commander-in-chief. I thought it was a place to go wash your hands, you see, and so I knew very little about administration. But, you know, administrative jobs aren't much different than treating patients. What do? You evaluate the problem. You see what the problem is. Then you find out all you can about that particular problem. You figure out what are the alternatives I have to solve this problem. If you don't know everything you should know about it, you ask people who do know. Get all the information you can, and then you make a decision. And being a dentist, an oral surgeon, making these decisions wasn't much different than making decisions from an administrative standpoint, because the process is essentially the same. You've got to use good common sense. And I say it was administrative, but I was still a doctor. I still insisted on, damn it, we're here to do dentistry. We're here to do it well. And everybody knew we were doing it that way. And so motivating the younger people there to do this, and I operated myself. I conducted continuing education programs just for our younger officers. I found that there was a tendency in the Army for some of the senior officers that when they got to the rank of lieutenant colonel and colonel, they kind of felt that that relieved them of doing dentistry. They kind of retired behind the desk. So when I set up these continuing education programs, and I did it in all the major commands, Germany, Berlin and Germany. Berlin was separate. Italy, France, up in the Netherlands, Italy. I said, I don't want anybody there over the rank of major. These are for majors and under. And the younger people liked that. And so they pitched in, and we really got the job done.
So when you look back at those 33 years in the military, what stands out for you as things that were really significant?
Well, I think the thing that I appreciated most is the fact that somebody like myself, without much education, 1 year pre-dental and 4 years in dental school, a poor country boy from Oklahoma could get there by hard work and by paying attention to what the requirements were. And then when I did get into the position of decision-making as Chief of the Army Dental Corps, it gave me the opportunity to stress the things that I've been talking about, and that is quality. You do the best you can for every person that you work on. And I stressed you can't do the best unless you have the background, unless you have the education. And we strongly emphasize continuing education. We strongly emphasize that career people get into advanced education. And we had wonderful advanced education programs in all the specialties of dentistry except orthodontia and public health. And our Army programs were excellent because they were staffed by board-certified people. They were there full-time. There was plenty of patients to treat. The facilities were excellent. So the training programs were unsurpassed, particularly in the field of oral surgery with those wars going on and the tremendous opportunities we had there. And so I stressed education. I don't know whether you know it or not, but I wanted the general practitioner to have the same recognition that other specialties had. In other words, we had boards that would certify somebody as a specialist in all of the specialties, but not for general practice. And so, as you may know or may not know, we established a board of general dentistry and set it up on the same basis as all the other boards. It was never recognized by the American Dental Association, but it was recognized in the military. And the Academy of General Dentistry has just recently established a board, and I think they patterned it pretty much after the one that's been functioning in the Army for a long time. We set up general dentistry residencies. 2 years of training program in general dentistry, the same as training in oral surgery, anything else. And the people that came out of that program were worth their weight in gold, particularly in Vietnam, where it was there was not much mobility except by helicopters. And you put these people trained in that program out on a base, and they could do 99% of what needed to be done. So, yeah, I hope I've answered your question.
Oh, you sure
because
did.
quality, and you can't get quality unless you have the ability. You don't have the ability unless you've had the training. And making that available is important. And if I did make any contribution in the military, I think that was it, the strong emphasis on training and making it available, not just talking about it, but doing it. Right.
What made you decide when you completed your military tour, 33 years, to not just sort of hang it up and retire somewhere? You decided to...
Oh, golly, I was 61 at the time when I retired, and I was still doing oral surgery. Even though I was Chief of the Army Dental Corps, I would get out to Walter Reed and I'd operate every week practically. And I was going to go into oral surgery. I was going to either go into teaching or go into private practice. You know that I was offered a position at Stony Brook, and you were on the faculty there. And Howard Oakes, I had gotten to know, and he invited me up, and we looked it over, and yeah, that looked good. My wife was with me, and she even went out and looked at houses, you know. So I was going to stay in oral surgery. Well, about that time, I got a call from Walter Guralnick, who is a very fine oral surgeon in Boston, Massachusetts General. And he says, "Bob, how would you like to be dean at Tufts University, School of Dental Medicine?" I says, "Not particularly." But anyway, he says, "Well, would you come and look at it?" And I said, "Well, what are you doing about it? You're a Harvard man." He says, "Well, I played tennis with the provost at Tufts University. A man that was a psychologist, Al Ullman was his name." And he says, "I suggested your name to Al, and Al asked me if I'd call you." And so I went up there, and I talked to Dr. Ullman. I talked to the other vice president of the university. I had lunch with the search committee, which consisted of, the chairman was Dr. Larry Cavazos, who's now the Secretary of Education here. But he was a professor of anatomy at Tufts University, but chairman of the board. And I had lunch with the search committee, and then I met with the president for a couple hours. And at 4 o'clock in the afternoon, I went back town and spent some time with the dean of the medical school. And I came home about 6 o'clock. And I didn't think anything more about it. And 2 weeks later, the president called me and says, "We want you to take this job as dean of the dental school." Well, there I was, Stony Brook or Tufts. Stony Brook had not yet taken its first class, and it would be at least 2 years before the students would get up to the point where they needed clinical oral surgery, and that's what I was a clinician. And so I waited altogether and decided that maybe I'd take the deanship rather than going to Stony Brook. So that's how I got there. I just wasn't ready to retire. I don't think I'll ever be ready to retire. Okay.
What was, when you got to Tufts, what did you see as the kinds of tasks ahead of you as a dean?
I saw real problems when I got to Tufts. The university, the dental school, was in the late 60s when we were having all the problems of protests and everything, that the dental school had gone through those same problems. I saw students coming into the clinic to treat patients wearing T-shirts and shorts and sandals. And I saw a rather sloven attitude about everything there. And so I immediately saw the importance of establishing a little decorum there, that people should look and act like doctors. And so I did not lay down any hard and fast rules, but I said, you are going to be professional. And so I think that was my #1 job, was to change the attitudes. They had let I guess the modes of the time interfere with professionalism. I think people expect something of their doctor. They expect them to be professional. They expect them to look and act like doctors. And so I put that in. I thought I'd have trouble doing it, but I really didn't. the students found out that I had no axe to grind. I was there to help them, to give them a good education. And my door was never closed. I listened to the students. First few days I was there, my secretary came in and said, there's some students out here that want to make some demands from the new dean. I said, would you repeat that? They want to make demands from the new dean. I said, you go out and tell them the new dean does not accept demands. You go back and tell him that he will like to discuss their problems. I will accept suggestions, but not demands. And that went through the school like wildfire. Then these students were looking for places to go, and if they wanted to go into a training program, I would personally help them. I'd talk to them. I'd write them a letter. I'd call. I worked hard for those students. And I found, you know, dealing with these young people, that when you're fair and honest with them, they reciprocate. And so it didn't take any time at all to really, really get the proper rapport with the students and get it back on the right track. We had real problems in some of our faculty. The dean of the dental school before I was there is a wonderful person. He had a training in public health, and he wanted to be a college president. And so he, during his last year as deanship, he enrolled in the Harvard Business School. And that's an exacting course, and he was spending most of his time in that, and he had appointed somebody as his deputy who was also the chairman of the restorative department. And this man couldn't do both jobs, and so the restorative department had gone downhill. And so I saw that problem, and I immediately brought back some of the older people who had retired. People that had taught before, who knew the problems. And yeah, they were retired, but they still were willing to come in and teach. And then...
Give me some examples of some of the people that you brought in.
The ones that were already there were Dr. Orrin Greenberg, who was a strong man in dental materials, and Dr. Walter Brown, who was a very loved instructor who had retired, but he agreed to come back. I bring in Dr. Jack Freese, who was an outstanding restorative dentist, practiced up in Concord, and he came down on a part-time basis. But that wasn't getting the job done. That wasn't solving it that was immediate. I knew quite a few people in dental education, and I had a great deal of respect for Dr. Maury Massler, who was then on the faculty at the University of Illinois. I didn't think he'd ever leave Illinois, but I went to see him, and I think he was ready to leave. His colleagues were leaving. Dr. Orban was gone, and Dr. Gottlieb was gone, the people that he had associated with. And he had, I don't know, maybe I shouldn't say this, but I don't think he got the recognition within the administration of the school that he maybe really deserved. And he had built up a lot of time there, and I guess had the retirement. So I asked him if he would come to Tufts as chairman of the Department of Restorative Dentistry. And he didn't hesitate. He says, when do you want me? And so we brought him there, appointed him a full professor, and he took over the restorative department. Now his background, as you know, was pedodontics.
Yep.
And he then pretty well got off into geriatrics. But anyway, he knew how to organize a department. And in his quiet, efficient, gentlemanly, scholastic way, he started bringing in people that were the right kind of people to teach in the dental school. And he held that position for about 4 years. And then we brought in a retired Navy dentist by the name of Joe Evans, who took over the department, and he was outstanding. And following him, we now have a Air Force retired dentist by the name of Askenis, who is our chairman. So our instructional programs have undergone a great transition in the time that I was dean to where I think we've got them where they should be. They're teaching people how to do good dentistry.
Now you were dean at Tufts in what span? From 72 to...
72 until early in 79. I was dean for about 8 years, yes.
Now during that came this American Dental Association presidency.
Yes, it did, yeah. Well, that's another story, isn't it?
Yeah, it sure is.
I hadn't been there very long, and I was active in the ADA. I had been chairman of the Council on Dental Therapeutics for over 9 years, and that doesn't happen, except that I filled an unexpired term for 2 years, and then I served 2 3-year terms of my own. I was made chairman the second year I was on it, and I was chairman for 8 years of that council. I was a consultant to the Council on Dental Education. They won on the annual sessions on research, and I was a delegate to the House of Delegates during the time I was in the Army, Chief of the Army Dental Corps. So I knew a little bit about the ADA. So I hadn't been there a year yet when a couple of people came to me and asked if I was interested in becoming president of the American Dental Association. And I said, well, yeah, I'd like that. And they said, well, we think we can get the New England states behind you. So I went to president of the university and asked him if he had any objection to me doing this, and he said, no, go ahead. And this is a political thing, you know. You have to really be elected by the House of Delegates. So the New England states, Massachusetts, Maine, New Hampshire, Vermont, Connecticut, endorsed me, which was the first step. And then we started a campaign to raise some money, and in 1973, in early 74, I was on the road a great deal, going around to all the different places, letting them look at me and say, I'm a candidate for president-elect of the ADA. And so...
Was it kind of unusual, a retired general to run for ADA president?
Yeah. When I made the decision to run, some of the politicians in the American Dental Association came to me and said, Bob, you don't have a chance. They say, after all, you got 3 strikes against you. You're a military man, and people are a little leery of the military, of that type of dentistry. You're a dean, and hell, nobody likes a dean. And you're a specialist. So all these things are against you. You don't have a chance. Well, they forgot one thing, Doctor. They forgot that I was a clinician, and that I had lectured in every state in the Union. And not only at the state level, but at the district level, and many times down at the city level. And so I knew a lot of people, and I don't know what it is, and people often ask me how I do it, but I remember people's names. And golly, in the lobby of the Washington Hilton right here, I'd stand in the lobby and somebody come by and I'd recognize them, call them by their name. And so when it finally came to the election, I did win. Yeah, I did win. And it was a real gratifying thing to do, to be able to move into that position as president-elect and then as president. So I really only had 2 years, you see, one as president-elect and one as president. But that's how it happened.
What did you come away with from those 2 years as president-elect and president?
Well, of course, one of the things you do is to see the real strength of the American Dental Association and its tremendous potential if it's used in the right way. The second thing you see is that you get the pulse of the dental profession. You learn their concerns because they level with somebody that is in this position. They tell you what they think is wrong, and at that time they were really concerned about quite a few things. They were not at that time too much concerned about the busyness. That came a little bit later, 4 or 5 years later. They were amply busy at that time, but they were really concerned about the infringement of the prepaid dental programs, where third parties were entering in and were trying to interpose themselves between the dentist and their patient. In other words, one of the reasons American dentistry is great is that the patient can select their dentist, the dentist can select their patient, and working together, they can determine what's best for this individual patient. But then some of these insurance programs were moving in and started talking about the least expensive, professionally adequate treatment. Now, they were concerned about that, and rightly so, because that had a problem, had an impact upon the quality of care. So they were really concerned about what the insurance programs were going to do for them, and the real importance for the American Dental Association that as a spokesman for all dentists to move in and with strong authority set this up. They were concerned about alternate methods of delivering dental care. They were hearing about HMOs, health maintenance organizations, and what effect that was going to have on their practices. They were concerned about other alternate delivery systems, like PPOs, preferred practice administrator, preferred provider, and IPA, individual provider associations, direct reimbursement. These are all things that were surfacing at that time that had to be addressed. At that time, this was in the middle 50s, we were having problems with the Federal Trade Commission. Federal Trade Commission were wondering if we were breaking the law in some of the things that we were doing. And in 1976, they subpoenaed all of our records and were going to take us to task about some of the things that we were doing. And our lawyers told us we weren't breaking the law. And so, as president, I told FTC we refused to comply. We did not send any of our records. Eventually they had to, but not at that time. And so, yeah, I saw this opportunity to hopefully provide the leadership. And next, the importance of preventing fragmentation. We were really having problems at that time. More and more dental organizations were establishing Washington offices. The American Association of Oral Surgeons established a Washington office. The Academy of General Dentistry set up a Washington office. The hygienists hired lobbyists here. And they were all speaking for dentistry, and they were speaking sometimes in different areas. They were telling stories that were not the same, and that was confusing our publics. And who were our publics? The government. The government, these people that we were dealing with in insurance, and particularly the public. And so my idea was that we've got to speak with one voice at the national level. Yes, differences of opinion are okay. There wouldn't be any rich lawyers or horse races if there wasn't differences of opinion. But we should solve those problems within the profession and then speak with one voice.
When you look at 1989 now, and this is, I guess about 12, 13 years after your presidency, how well have we done in the area of fragmentation?
We've made some progress. We've made some progress. The Academy of General Dentistry and the American Dental Association are working very closely together now. We don't hear the real problems of the fragmentation that I spoke about. Most people are telling the same story, although there's an interim period here where it became quite bad. Could I give one instance?
Sure, please.
One instance was about a technique of doing endodontia known as the Sargenti technique, the use of a product known as N2. This was a real controversy within the American Dental Association, but it was taken out of the American Dental Association and got to the FTC, the Federal Trade, the FDA, Federal Drug Administration, and it got to a congressional hearing before the Fountain Committee. And so two different groups were going before that committee and was getting into all the newspapers and everything, and that is real fragmentation. And so I was chairman of the Dental Drug Advisory Committee for the Food and Drug Administration at that time, and so we had that hearing before us. And some group were vehemently against this, others were for it. But that's fine, that's all right. But do it within the profession, not in the public scene. Since that time, other problems have replaced the ones that I mentioned. The ones that are primarily concerned in the interim period was the busyness of the dentist. They felt that we were overproducing dentists and that the dentists weren't nearly as busy as they used to be. Then the problem of malpractice raised its empty head. You know how the premiums have escalated and all of this problem. An expansion of alternate delivery systems, the PPA and the IPAs and direct reimbursement all came in.
You were seeing just the beginnings of those issues during your presidency.
During my time, but they have loomed into the meantime, and they are the current problems that are facing. And the problem of government intervention is still there. The FTC thing has never been satisfactorily resolved. The problem of OSHA, as you know, is really a tremendous big thing that's going to have a serious impact upon the individual dentist. And hopefully the American Dental Association can assemble the right facts, scientific facts, that they can go to OSHA and say these really don't apply to the individual dentist, and be able to convince them to change the regulations that they are talking about implementing. EPA and all these things.
Let's stop at this point, because I really want to come back to some of these issues in just a few minutes, because we're almost at that 45-minute mark now, and we're going to give them a chance to kind of change their tapes, and we'll get a chance to stand up and a few things like that. Dr. Shira, we were just talking about some of the issues that you faced as president of the ADA, and the degree to which some of those same problems are, in fact, present today facing the profession. And if you were to kind of sit back and say what you would feel would be the major issue facing dentistry today, what would that be?
Well, I think it's a continuation of other problems that we've had. I think one of the major issues facing us today is the proposed OSHA regulations. In other words, the things that the dentist will have to do in his office to prevent the transmission of infections. This is a real major problem, and if it's to be implemented the way the government is currently thinking, it will be a tremendous financial burden on the individual dentist, and that in turn on the patient.
Let's expand on that for just a second, and you have I think a unique perspective in terms of from your ADA role, but also as an oral surgeon.
Yes.
And have spent a whole professional career dealing with preventing the transmission of infectious agents.
Well, the idea that we have to label everything the way it has to be labeled, we have to dispose of things a certain way, is something that we've never had to face before. I think the main problem that we have in this area is blood-contaminated objects and also needle sticks. Well, if we can handle the needle sticks, there's an awful lot of dentistry that doesn't involve any blood content. And to make you do this for every procedure that you do is probably not necessary in the area. Yes, in oral surgery, we do an awful lot of surgery on an outpatient basis, which means that we're not absolutely sterile like we are when we go to an operating room. And we have had little or no problem with transmission of infections in the way we do surgery. And so to see some people come in because primarily of the problem with AIDS, to make that go down to all procedures that we do in dentistry is going to maybe work a hardship on the dentist and in turn on the patient. Yes, so that is one of the major problems. Another major problem is the problem of getting proper auxiliary help now. There's a great shortage of hygienists throughout the country. Where I practice now, or where I live now in Boston, we have a fantastic hygiene school there at Forsyth Dental Center, one of the finest in the country. They usually take 150 students a year. They just can't recruit them. They're down to less than half of that now. And there is a great shortage of hygienists and also good dental assistants on the national level. And that's something that the American Dental Association has to face and do something about.
When you were speaking before about the fragmentation in the profession,
Yes.
I thought you might be alluding at that point to what seems to be fragmentation now between dentistry and dental hygiene.
There's no question about that, and it's something that is not going to go away. It's got to be faced, and there's got to be something done to give the hygienists the recognition that they want and that they deserve as an integral part of the team that is providing oral health care. Some people speak about the dental hygiene profession, the dental assisting profession. There is one profession, and that profession is dentistry. And it takes a lot of people to do what needs to be done. It takes the dentist himself, it takes a dental hygienist, it takes a dental assistant, it takes a dental laboratory technician. It many times requires a manager of some kind. But that's only one aspect of it. That is the delivery of care, but you got to get people prepared for that. You've got an educational column over here that has to be looked into. You've got to make sure the dentist is educated, that the hygienist is educated, and that the assistant and laboratory are educated. And these are all problems the ADA must face. And then there's one other column, and that's the dental industry. People that develop our materials, develop our equipment. These are absolutely essential to the proper delivery of health care. So when you start to fragment it into hygiene, assisting, laboratory, teaching, research, and industry, it falls apart. It's one.
I think what typifies your life has been the fact that you've risen to levels of leadership in virtually everything you've done. And we've only touched on a few things, and I think if we went back over your history, we would see other presidencies and of different organizations, editorship of journals.
Yeah.
Given the number of problems that are facing dentistry now, what's your sense about the leadership and what we have and what we need to get at?
Well, we have capable people in dentistry. There's no question about it. We have really capable people, and we have a strong central organization, and that's the American Dental Association. I think their primary concern, their primary responsibility is to maintain the wonderful image that we have of our profession. We are looked upon by the people we serve as being people of honesty and integrity. In 1987, the Gallup poll ran a survey asking the public to evaluate the honesty and integrity of the professions and occupations that provide them services. And this is quite revealing. They came out number 1 as the pharmacist. Number 2 was the dentist. Number 3, the clergy. Number 4, the physician. Number 7, the lawyers. And rubbing elbows down at the bottom of the list were journalists, politicians, and used car salesmen. And that's the public's concept of us. Now, to me, that means that dentistry is on a pretty high pinnacle of respect and dignity in the eyes of the people we serve. And how did we get there? We got there because dentistry was run by dentists. We were the sole arbiters of what went into our profession for many, many years. We were able to provide quality care, and there's no question but what the quality of care done in the United States is by far the best in all the world. There are a few areas, some parts of England, some parts of Scandinavian countries, but everybody looks to the United States for guidance and for direction in where the profession is going. And look what's developed in just recent years about this quality. The high-speed air rotor, the Panorex X-ray, the composites, the more potent anesthetic agents that will give us real good, long, prolonged anesthesia, the implants that we are now doing. These are all advances in making dentistry better for the people. We're an aging population as well, and the aging people are finding out that, yeah, they don't have to give up their teeth. If they take care of them properly, they're going to keep their teeth. And we realize that there's, what, over 35 million people now over 60 years of age.
Do you have any concern that this image might be eroding?
Yeah, well, let me finish what gave us this image. Number one is the quality of care that we give. Number two is the delivery system. The delivery system that has made American dentistry great, allowing the patient to select their dentist and the dentist to select their patient, and working together to work out what's best for that individual. And then the third thing, and maybe the most important, is the professionalism of the dentist. The adherence to a strict code of ethics that will let the people have confidence in the fact that when they go to this individual, that he will do what's right for them. In other words, a professional man is somebody who has skills and knowledge that nobody else has, and that these skills and knowledge are important to the well-being of the people he serves. And they've got to know that he's going to be honest with them. He's going to do what is best for them in every situation. He will not exploit a patient for his own personal gain. He will keep up to date with what is going on in his profession. He will take an active role in his community, in his church, in his city government, in his schools, and all of this. And he will treat his patients with skill, with confidence, with compassion, and with dignity.
Well,
now, that's what made us great.
Okay.
Now, this professionalism, I'm afraid, has a tendency now to become eroded. And I think there's several reasons for it. We are finding now that some people have peculiar ideas about what is success. And some people are looking for a gimmick that will give them an advantage. And there is no gimmick in dentistry. The way to build a practice is to do good dentistry. Take a patient and do the very best you can for them, and then that patient will send you another one. Now you got 2 patients. You do the same for both of them, then you got 4. That's the way you develop a practice. However, in the current environment, we are finding that some people, if they have to make a decision between professional care, high quality, and production, the production will get the upper hand. So that's one of the main things that's eroding, that has a chance to erode it. Number 2 is consumerism. Ralph Nader made the public consumer conscious. And we have played into that hand with the advertising that some dentists are now doing. And it is called marketing in some areas, but when you really look at how some members of the profession are doing, it's hucksterism, pure and simple. When you look in your telephone directory, you see such things as family dentistry. What the hell does that mean? Is there anybody that doesn't work on some member of a family? I don't know what that means. Or we treat cowards, or dentistry with a smile, and this type of thing. And these things erode the public's impression of our profession. You know, 68 years ago, the learned professions decided not to advertise. And they decided not to advertise, not that it wasn't bringing patients into their office, but that it was misleading the public. They were getting to expect something that they weren't going to get. Now, that's been a long time ago. And I think it's time now for our leaders in dentistry to speak out again and say, what is the end result of this? Let's keep these professional standards high and not mislead the patients, the public, through this advertising. And while there is some attempt to control advertising, we still see these things coming out. Another thing That erodes the problem, and we've already mentioned the breakdown of communications between the patient and the dentist because of the third parties. We've got to say, look, dentistry is an individual thing between the provider and the recipient, and there shouldn't be anybody in between. They should be able to work out what's best for that patient, not somebody intervening and saying you can't do that particular type of work for that patient. I think we've got a problem of, in our own profession, of what we call gloom and doom among some dentists. During that time when there was a lack of busyness, which I don't think is here now, there's some dentists that were very pessimistic about the futures and that they wouldn't have their own son or daughter go into dentistry. Well, there's never been a better time in the world than to be a dentist right now. Our image is high. The dentist is among the upper 10% in income producers in the United States. With the aging population, these elderly people are going to need care, and the patients are going to be there for us. And so the population is increasing, the number of dentists is decreasing. There isn't a better time in the world to be a dentist than right now, and yet some dentists still have this gloom.
Reflect for a minute on the closing of the dental schools. I mean, we heard just recently now the Washington University in St. Louis.
Washington University in St. Louis, Farley Dickinson University, Oral Roberts in Tulsa, Georgetown here, Emory. There's 5 of them that have closed. And Oral Roberts is also closing his medical school, by the way. Well, these are all private institutions. Dental education is expensive, and some of the schools that are closing had been receiving state money, and some of that state money has been pulled away from them, and they feel they can't cut the mustard anymore with the high cost of maintaining a dental school and the education. And so all the schools that have closed have been private schools, you see, and that is the problem. Main problem. Secondly is the decreasing applicant pool in dental schools. Georgetown closed because they felt that they weren't getting the quality of student that they once got. And that all goes back to what is the future of dentistry. And people are afraid that with the advent of preventive measures, a caries vaccine that may come on the market, the chlorhexidine wrench that is going to handle plaque and maybe decrease the periodontal problem, that there won't be anything to do. Well, that's just not true. There's plenty to do. There was a study done by the VA up in Boston that shows that elderly people develop cavities twice as fast as children. There's evidence to show by Simonson from Iowa that fluoride treatment is beneficial to the elderly people because of the exposed root surfaces and the need for fluorides there. The elderly people are more affluent than they used to be. They've got the money. There was a survey done by DDS, that was the newsletter of the marketing division of the ADA, in which they pointed out that about 57% of the people didn't go to the dentist, not because of finances, but because they didn't perceive the need to go every year. And there is where the ADA's got to really get into it, to convince people to be healthy. Your mouth has got to be healthy, and the only way to keep your mouth healthy is to see your dentist regularly. So that's another eroding factor. Number 3, criticism of one dentist to another dentist. Now, we realize that some dentistry is not up to par, but maybe that's the best that individual could do. So the important thing is, if there are problems, talk to the dentist himself about it, not tell some patient that that was lousy dentistry that you had done. That erodes it. I guess there's other things. The problem of drug and alcohol abuse is not something that's limited to the general public. We have it in our own profession. We have organizations now that are working to get around this. So these are things that have the tendency to erode the image of our profession. And I believe, Dr. Adelson, that it's important for organizations like the one that we are representing today, the International College of Dentists, the American College of Dentists, the Pierre Fauchard Academy, the Academy of Dentistry International. These are people that are made up of the leaders of our profession. And I think it behooves organizations like this to be alert to what's happening, to identify these things that have a tendency to erode our image and will reduce the confidence the public has in us as individuals to provide honest care, and seek these out and do what is necessary to correct them. So that's what leadership is.
Well, if you had to give a message now to the top of the organization in the International College of Dentists, and you were to say to them, here's an agenda for you to follow, what would you suggest they do?
Oh, that's a difficult question to answer, because who am I to tell people that have been in the college for a long time to what they should do? But I think they should...
I mean in terms of addressing the particular...
I think they should address the thing that made dentistry what it is today. In other words, the professionalism, the high level of professional standards, ethical standards that we have established, and see that they do not erode. See that they do not erode. In other words, at one time, the health planners would have reduced us to the status of a trade. They felt that we could produce dentistry the way General Motors produces cars or the electrical company produces electricity. That's not a profession. We are professional people. You know, great responsibilities fall on the shoulders of a physician and a dentist and anybody else in the health services. A good many years ago, 1969 I think it was, the Department of Labor issued a bulletin stating that there were 21,741 occupations awaiting the graduates of our universities at that time. Just think of that. 21,741 ways that people make a living. There's more than that now because that was, what, 20 years ago. But anyway, did you stop to think deeply about this? That how many people in the occupations professions are given the right to do what a dentist can do? A dentist can operate on living tissue, prescribe drugs for a human being, and relieve pain and suffering of his fellow man. Now, there's not very many people that can do that. The physician, the dentist, the osteopath, the podiatrist, the optometrist. There may be a few more, but it's less than 10. And in my opinion, that sets these people apart. They're different than other people because great responsibilities fall on the shoulders of the health providers. Why? Because they're treating human beings. They're treating somebody else's loved ones. And it's important that they treat them the way they would want their own loved ones treated if they had that problem. So you see, professionalism is it. Don't let the money enter into it. Do what needs to be done, and then the money will take care of itself. I wonder
if you would mind telling that little story that you had sent me in a letter that when you talked about the fact that you had treated President Eisenhower and also the girl in Vietnam.
Okay. I was chief of oral surgery at Walter Reed, and I received a call from the president's physician, or president's dentist, that he needed to have an upper left second molar removed. This was a cracked tooth syndrome that had broken into the pulp, and they had tried to hold the tooth together, but it didn't. It blew up. And so the president came into Walter Reed that morning and surrounded by all of his staff, and I was called upon to remove that upper left second molar. He's like any other patient. He came in, he says, you know, Colonel, I'm not looking forward to this. He says, I've only had one other tooth taken out, and it took 2 hours to get that one out. And I looked at that x-ray, and that bone was so dense, I couldn't see the outline of the roots. And I said, well, Mr. President, I may do this a little differently, but I don't think it'll take me 2 hours. And so I turned a flap, removed bone, removed bone, used my elevator to loosen it, and then lifted the tooth out. And fortunately, he got along fine. I often facetiously say I didn't extract the tooth. I merely set the force upon it and I shook it out. But anyway, it came out. And it was a great experience to work on a great man like that. It was written up in Time magazine. It made the front page of the Washington Post, and it was a great experience. But then, a good many years later, in 1970, I was in Vietnam on a inspection tour, and we were going by helicopter around to these bases all around Vietnam, and we had many of them where only one dentist was there. And this was down in the Delta, where the French had fought the Vietnamese years and years ago. And we were there about 3 o'clock in the afternoon, and the dentist there was a recent graduate from one of our dental schools. And he asked me to see a little girl. There was a little Vietnamese girl there that had been hit by a motor scooter, and she had a rather severely fractured mandible. It was really a fairly complicated one. And so I looked at her, and I realized there was no place for her to go. There weren't any hospitals in the area, and we didn't have any there. There were no Vietnamese hospitals. And so I told the people that were with me, I said, we're going to be here a while, and I'm going to stay here and take care of this little girl. And so I anesthetized her, and I reduced that fracture, and spent some time with that young dentist telling him how to take care of it afterwards. And then we flew back to Saigon. And from a professional standpoint, I kind of think I got more satisfaction out of treating that little girl than I did the president. Anybody could have taken out the tooth on the president because he was in a situation where there was a big hospital, and of course there would be somebody there to do it. But out in Vietnam, there wasn't anybody else there to do it. And I did it. And that to me is what is being a health professional. You take care of people, and that's what dentistry has done, and it's what made dentistry great. Because, Dr. Adelson, don't ever sell dentistry short. It is doing a tremendous job for the people of this world. What would the world be without dentists? It would be terrible. And so there is need for dentistry. There's need for good dentistry. And there's going to be need for dentistry in the years and years ahead. And it's the responsibility of our leaders in the American Dental Association, in the International College, in every dental organization, to keep stressing the important things that we are providing, an important service that nobody else in the world can do, and that we've got to maintain the standards and improve upon the standards that we have developed.
I want to ask you about something that you wrote in an article in 1972 that sort of addresses that. It was a paper that you did on, actually, as it turns out, the role of dental schools in increasing the emphasis on preventive dentistry and dental practice.
Where did you find that?
Well, libraries are wonderful places. Well, but there was something in here that caught my attention, and it's sort of just relevant to what you were just saying, and it had to do about the role of dental school in some of these areas. And what it says is the proper role of the dental school then is not merely one of catching up, and you go on to say, properly, it is also one of preparing for the future, taking action so that 10 or 20 years hence, we will not have to discuss how we are going to do what already should have been done. And I was wondering if you might want to comment on how well dental schools are living up to what you wrote in 1972.
I think they're doing a better job all the time. You see, with the changing concept of dental practice, with the preventive measures becoming more effective, decrease in the incidence of dental caries, the role of prevention of periodontal disease, the general practitioner is going to have to be doing things in the future that specialists are doing now. And I think the dental schools have caught this philosophy and that they are expounding on it. There is a peculiar problem in dental schools that we haven't found a solution for, and that is to teach a youngster how to run a practice. Because in dental school, the faculty put requirements on him. He's got to do X number of these, X number of those. He's got to do a gamut of work before he graduates. And that is the #1 objective of that dental student, is to get those things accomplished. He hears about preventive dentistry, he hears about practice management and how to manage the practice, but that's something that he's going to face tomorrow. He's not there yet. And the dental schools have not yet found a way to let that young man know, and that young woman know now, that these things that he's going to do after he gets out, he's better start learning to do them while he's still in dental school. But I think it's safe to say that the dental schools are run by intelligent people. We've got some exceedingly fine faculties throughout the country, and they see these problems and they adapt their curriculum to them. I don't think there's any question about that. A good example is geriatric care. Many schools have now established departments of geriatric care. And getting back to Dr. Maury Massler, you see, he was a pedodontist, but he has been really working in his later years in geriatrics. And we at Tufts have established a Maury Massler Geriatric Center where we're going to be able to provide care for elderly patients, but more than that, to teach general practitioners, continuing education, the special problems that the elderly people have, and to do research in this particular area. And we're naming it after this great man of dentistry. Wonderful. Yes.
Let me turn away from the profession a little bit and talk a little bit about Robert Shira. When you look back, I wonder if you might tell us a little bit about who the important people are or were in your life.
Of course, my father and mother. That brother I mentioned early in this career, he was a wonderful person, and I thought an awful lot of him, and I became a dentist because of him. Then, while I was in dental school, I met a very lovely, lovely young lady that was in the hygiene school, and a year after I graduated, we married, and she's been my helper all these years. We have 3 lovely children and 8 grandchildren, and just recently a great-grandchild, the first one to come along. So those are my family background, and we're so proud of our children. They've all done well and don't need their dad and mother anymore. In my professional life, I've run into some people that meant an awful lot to me. The oral surgeon that was at Letterman and I was there was very kind to me, and he would let me do things that got me started in surgery. When I got to Letterman, there was an oral surgeon that came in occasionally as a consultant who was a very astute diagnostician, and I learned from him. I guess I learned from everybody that I can. I'm a humble person. If somebody knows something that I don't know, I want to know about it, and I've learned from an awful lot of people. And in the military, of course, the association I had with General Heaton, which I can't help but believe was responsible for me first getting to Walter Reed, and then from there to get to be the chief of the Army Dental Corps. These people all had a big influence on my life, and then getting into the university, I had a good faculty to work with, and brought in people like Maury Massler, and a good understanding president of the university. Then, after I'd been there about 3 years, we had a change of presidents and brought in a man with a national reputation as a nutritionist, Dr. Jean Mayer, who is a fantastic individual. He's got a mind as sharp as a tack, and he's coming up with new ideas all the time. And after my tour as dean, he appointed me as the senior vice president of the university, so I worked closely with him. And during that time, we started a veterinary school, a school of nutrition, a nutritional research institute, a school of biomedical sciences, built new buildings all over the place. We have really expanded the university in that time, and I was a part of that, working right with him all the time.
How about regrets? Anything you do different?
Yeah. Oh gosh, I don't know. I don't know. I wish I had to do over again. I'd like to start again, knowing what I know now, and I'd be a better dentist. Yeah, no, I have no real regrets. My wife had a regret for a long time about us giving up our very good private practice to go in the Army, but she finally adjusted to that and has accepted it. I don't regret going to Tufts instead of Stony Brook. I think it worked out to be the right decision. I know that Stony Brook was close to your heart.
Yes, in case Howard Oakes is listening to this.
Yeah. I think I would have enjoyed Stony Brook. In fact, I know I would have, but I've also enjoyed the challenges that I ran into at Tufts. So My biggest concern is, what am I going to do now?
Yeah.
And
what are you going to do now?
well, I thought that I would be through at the university long ago. I went there in late 71, expecting to be there 5 years, and I'm in my 18th year now. They still find things for me to do, and I'll stick around there a while longer, and then I don't know, I probably be at the point then I won't be able to do much at that time, but I'll keep interested in my profession, I assure you.
Is there anything that you feel you'd like to be involved in and that you've had to put off?
There's one thing, when I was contemplating retiring from the Army and what would I like to do, there was one position that I thought I could do some good, and that was to join the staff of the American Cancer Society and point out the importance of the early diagnosis of changes in the mouth. I would have loved to have done that. But that didn't work out. They didn't have such a position, and I don't know that I could have done that. Another thing that I thought about doing when I retired was to go to some school that had a big clinical practice and spend my time in continuing education for the private practitioner who went through dental school without too much experience in surgery. And I'd be there all the time, and they could come in and work with me, and I'd be there to take care of the patients post-operatively. I thought that would be a wonderful thing to do, because there's no place that I know that you can go and get on-the-job training in surgery. And I thought that would be a good thing to do. So I had a few choices coming up, and whether I selected the right one or not remains for history to say.
What does Dr. Shira do when he's not involved with the school?
I edit the O Journal.
That's what you're doing for fun?
Oh, well, that's what I do, because it's a monthly journal that has 124 pages in it every month, and the articles keep pouring in that have to be reviewed properly, and it takes a lot of time. Yes. And I've done that since 1967. I did it all the time that I was president of the ADA, and it took a lot of time, and many midnight hours and weekends went into that. Yeah, I was a golfer at one time, but I haven't played golf since I went to Walter Reed, because I was just too busy. Yeah.
You're still keeping track of the football scores, though?
Absolutely.
Yes.
Absolutely. Yeah, I'm an avid football fan. I hate to see the Redskins lose.
So do most of us. Dr. Shira, if you were to give some young people out there kind of a prescription for leadership, what would what kind of advice would you give them?
Well, I would say the best way to develop leadership is to pay attention to what a very smart man once called the 4 I's. Intelligence is the first one. You know, we all have minds with which we can absorb knowledge, relate one fact with another, and draw a logical conclusion. We do that all the time in our work, in our profession. But we realize that to be intelligent, you got to use that mind, that you can't throw away the books and say, I know it all. George Bernard Shaw once said that most people think once or twice a year, and he established his reputation by thinking once or twice a week. So you've got to use your mind to develop it, and so you've got to constantly stimulate that through what? Continuing education, through your literature, through your experiences, through contacts with other dentists. So keep learning. And as you learn to separate the good from the bad, and use the good and discard the bad, and learn to teach as you are learning. Pass it on to other people. Number 2, initiative. You've got to take the initiative if you're going to be a leader. There is a cartoon that's been used in our command and general staff school for many years, and it shows a picture of a turtle that says, "Behold the lowly turtle, he progresses only when his neck is out." And so if you're going to be a leader, you got to stick your neck out. And sure, the axe may fall, but it probably won't. And by taking the initiative, you will be able to answer many of the problems. I often say, always remember that that wonderful opportunities are often beautifully disguised as problems. And so take the initiative. Look around you. The people in the military, the younger people that become general officers, they rise to the top, but there are other people with exactly the same length of service, same background, same training that don't get there. Why? Initiative. They become leaders. Number 3, imagination. You know, you got to extend yourself beyond the common realm, the current realm of knowledge. You got to project yourself into the unknown, and that's the way new discoveries come about, and you've got to use your imagination. But imagination and vision are closely allied, but if you just have that, you don't have anything. You're a dreamer. You've got to add to that a task. So vision and a task is the secret of the future. And then lastly, integrity. 4 eyes integrity. You got to be honest with yourself, with your colleagues, with your patients, with your family. You got to look in the mirror and say, what kind of a professional person am I? So I hope I answered your question.
You sure did.
Intelligence, initiative, imagination, integrity. I think those are the things that if you develop those to a high degree, you will automatically become a leader.
That's wonderful. Thank you, Dr. Shira.